Welcome to the deep dive. We've got quite a bit of material from you today, and we're going to really get into a critical topics. How do we make artificial intelligence actually work well and, fairly across India's healthcare system, considering its, well, incredible diversity?
That's the core mission today, yeah. Based on the sources you sent, we'll try to unpack the main challenges, especially those tied to India's, vast linguistic and cultural differences, and maybe look at what paths forward the material suggests.
Right, because there's a starting point in these sources is key. India isn't uniform. Not at all. You've got hundreds of languages, dialects, different cultural views on health, local practices. It all affects how people interact with healthcare.
Exactly. And for AI to be genuinely useful for everyone, it has to somehow navigate all that complexity.
So where do we start with that? What's the first big hurdle the sources identify?
Well, the first one that really jumps out is language support.
Seems obvious, maybe. But yeah, when you think about AI needing to process medical stuff, NLP, voice recognition, it absolutely has to work in multiple Indian languages, not just English.
Precisely. Your sources specifically call out languages like Hindi, Tamil, Bengali as needing solid support. I mean, think about it, an AI system trying to understand a patient describing symptoms in their own language.
Or a doctor dictating notes quickly.
Yeah,
Right.
that needs natural language processing engines that are actually built, or at least heavily fine-tuned, on multilingual models that get the nuances of Indian languages.
So if you, the listener, are maybe using an AI health tool, or your doctor is using one for notes, it needs to properly understand and respond in your language. What about voice specifically?
Oh, voice recognition is becoming huge, isn't it? Especially with these large language models helping out with clinical notes or exploring treatment options. And it's not just the back-end tech.
The interface, too.
The user interface? Absolutely. Think about something like discharge planning. Explaining that clearly, accessibly in someone's regional language is vital, especially if they're not fluent in English.
Okay, so language is absolutely foundational. But you mentioned it goes deeper than just the words. The sources talk about cultural context.
Yes, and this is where it gets really fascinating and pretty complex. Cultural sensitivity and localization. It's not just about translating words. The AI's knowledge base, the information it provides, needs to be truly localized for India.
Meaning what, exactly? Incorporating local details.
Yes, things like understanding common local diseases, common treatments that might differ quite a bit from region to region. It needs to be relevant information.
Ah, okay. So an AI shouldn't just give generic advice for a symptom, but understand, say, oh, in this area, this is a more likely cause.
Exactly. It has to connect with the local reality. And also, simplifying complex medical information like those discharge instructions, again, requires real cultural sensitivity. You have to avoid jargon, frame concepts in ways that make sense to people from very different backgrounds.
That applies to training tools as well, like for medical students.
Yeah, the sources mention adapting content for medical education too, making sure it fits the Indian medical context and, local clinical practices.
There was that really good example in the material about adapting a heart failure plan from the West for rural India.
Right.
It wasn't just changing drug names. It was about adjusting dosages based on what drugs are actually available locally and even considering local diets. That's way beyond simple translation.
It really is. It's about making sure that AI's advice is practical, usable, and actually effective in the patient's real life. Now, all of this, the language, the culture, it all depends heavily on the data the AI learns from.
Which brings us to the next big challenge.
The absolute need for training AI models on truly representative data.
Okay, so the data has to reflect the population. Why is that such a specific point for India, according to the sources?
Well, because India's population has incredible diversity genetically, environmentally, lifestyle-wise, the material is very clear. You need large, high-quality data sets from Indian patients to ensure accuracy and fairness.
So you can't just take an AI trained mostly on, say, North American data and expect it to work perfectly for someone in Kerala or Assam.
Definitely not, especially for things like genomics or personalized medicine. The sources argue it has to be tailored to India's specific genetic variations and common disease patterns.
What kind of India-specific data helps?
Things like regional disease prevalence patterns, dietary habits across different communities, socioeconomic factors. All of this can significantly enhance how accurate and relevant the AI models are.
And the flip side, what happens if the data isn't diverse and representative?
That's the critical danger highlighted. Without that diverse data, AI models can inadvertently pick up and even amplify existing biases that might be lurking in narrower data sets.
Leading to unfair or unequal outcomes. So your health outcome could potentially be worse simply because the AI wasn't trained on data that included people like you from your community.
Precisely. It becomes an equity issue, fundamentally. Access to good AI-driven healthcare shouldn't depend on whether the training data happen to reflect your specific background within India's diversity.
Okay, so we've laid out some pretty significant hurdles. Language barriers, deep cultural nuances, and the critical need for representative data. But the sources don't just stop at the problems, right? They talk about solutions, strategies.
Yes, they do point towards a path forward. A crucial first step mentioned is investing seriously in data collection and standardization efforts. And the key here is that these efforts need to be designed right from the start to actively capture that linguistic and cultural diversity.
So it's not just about collecting more data, but collecting the right data with diversity built in intentionally.
Exactly that. And connected to this, the sources also stress the importance of promoting open standards and APIs. Think interoperability.
Making different systems talk to each other.
Yeah. In a country with so many different health IT systems, maybe in different languages initially, you need ways for them to share data and communicate effectively. Open standards help enable that.
Is there any larger framework helping with this in India?
The sources do mention initiatives like the Ayushman Bharat Digital Mission, or ABDM. That's India's push for a unified digital health infrastructure, which is pretty vital for enabling this kind of large-scale data sharing and standardization we're talking about.
Makes sense. And technology alone won't solve it, presumably?
Not at all. Collaboration is flagged as absolutely essential. Partnering with local health experts, with communities, with technology developers, with research institutions, that's critical for building solutions that are actually grounded and effective locally.
What about the people using these tools?
Good point. The sources also bring up the need for training healthcare professionals, making them AI literate, comfortable with data analysis, and also ensuring the AI interfaces themselves are user-friendly, accessible even for people with lower digital literacy. That's huge for adoption.
It really sounds like a multi-pronged approach then. Tech, data, policy, training, collaboration.
Yeah.
It all has to work together.
It does. Acknowledging this linguistic and cultural complexity isn't just identifying a problem. The sources frame it as the essential first step to building AI that can genuinely benefit everyone in India, equitably.
So bridging that language, culture, data representation, it's paramount.
Absolutely. It means actively working on these solutions. Better multilingual support, real cultural localization, building those representative data sets, and fostering strong partnerships.
Because the ultimate goal, as the sources suggest, isn't just smarter tech, is it? It's about building systems that are, what was the phrase, culturally intelligent.
Culturally intelligent, linguistically capable, inclusive, and fair.
Paving the way for a healthcare future that feels less like just technology and more.
Well, deeply human-centered, reflecting India's unique character.
Exactly. A future where the AI truly understands and serves the people.
So, thinking about that, what does a truly deeply human-centered AI healthcare system actually look like in practice in a country as diverse as India? And maybe for you, the listener, think about your own community.
Yeah.
What specific example of that kind of culturally intelligent AI could make a tangible difference right where you are? Definitely something to mull over.